You need to have done the job to know arm protection is long overdue. The importance of your safety is equal to that of your patients. You have the right to be safe at work irrespective of whether you are based in hospitals, in the community or other healthcare premises. Employers are required by law to identify hazards to which staff are exposed and take all reasonably practicable steps to eradicate or minimize them. Why do the job if you don't like what comes with it? It is not part of the job. It is an employer's duty to protect the health, safety and welfare of their employees and other people who might be affected by their business. Employers must do whatever is reasonably practicable to achieve this. This means making sure that workers and others are protected from anything that may cause harm, effectively controlling any risks to injury or health that could arise in the workplace. Don't leave your organization liable. Protect the arms of your staff now. An NHS trust has been fined for failing to prevent or even monitor at least 23 cases of dermatitis among its staff, with failings by its occupational health team highlighted as part of the prosecution against it. The trust had failed to carry out regular health checks of employees to detect any symptoms of dermatitis or other skin issues. The scale of the problem came to light only when an HSE team inspected the trust, and it emerged 23 cases had not been reported to the executive, as is required by law. The trust was fined £10,000 and ordered to pay costs of £9,620 for a breach of the Management of Health and Safety at Work regulations. HSE Inspector Emma O'Hara, speaking after the hearing, said, "The Royal Cornwall Hospitals Trust, which employs 5,000 people, failed to have an adequate management system in place to prevent dermatitis, a recognized condition in the health sector, and deal with it when it arose. Employers must ensure they identify risks to staff and come up with plans and procedures to minimize the risks and make sure cases that do occur are properly treated and recorded. Put an end to preventable arm injuries. It is not optional, and it is not part of the job. Are teeth and nails included on your risk assessments? Question on agincare.com forum. Mum's in advanced stage dementia at this point, but is lucid enough to know if anyone is doing anything to her hands. She won't let anyone, and I mean anybody, trim, file, or clean her fingernails. It's really disgusting and unsafe for the care workers at the dementia home. She fights pretty vigorously, scratches, claws, and is really aggressive about it. I believe she is breeding the next plague with the gross mess trapped under her nails. So I thought I'd ask what has worked for others in this situation. We have tried the rational approach, which everybody with any experience with dementia knows doesn't work. Please, I'll paint your nails if you let me, you're going to hurt yourself, etc. I've tried distraction with music and talking to just try to wipe underneath with a bathing wipe. No good. None of us have any intention of getting slapped and scratched by her over this. 90% of bites and scratches happen to the arms of nurses. Bare below elbow except when at risk. Reduce the risk of infections to nurses. Bites or scratches can lead to diseases such as sepsis, necrotizing fasciitis and skin-to-skin infections such as MRSA, CTIF and scabies. You reduce workplace injuries, a scratch leading to a minor scar circa £1,500. Bite to a care worker £50,000, monkeypox caught by contact with contaminated sheets, compensation undisclosed. Meet HSE laws, appropriate PPE must be provided. Meet patients' needs. IP Journal survey on overuse of gloves showed patients would prefer not to have skin-to-skin contact when receiving personal care. Arm protection against body fluids. When working with the vulnerable, distressed when manual handling. When delivering personal care. When toileting. When cleaning. When handling contaminated sheets. Care professionals have been at risk of skin-to-skin infections, HCAI, prior to COVID. The gloves were too short to cover my arms and left my skin exposed while changing the bed. I think that's how I got infected. Carer safety must also not be compromised. Gipskins PPE. Grip infection protection sleeves. Bite, scratch and tear resistant, reusable, cleanable, fabric compatible with Clean-Air wipes, waterproof, antifungal with antimicrobial properties, fire retardant, non-threatening and discreet, breathable and latex-free, bonded seam Startex material. Join the growing number of organizations in 2021 who agree arm injuries are not part of the job. COVID-19 and influenza. Cough and sneezing. I see etiquette is required even when wearing a mask. Even safer if the arm can be cleaned after coughing or sneezing. A cultural solution. Gipskins PPE are the market-leading infection control and injury prevention sleeves for the workplace. Key benefits: protect and safeguard staff, meet your duty of care, be compliant with H&S Act 1974, reduce preventable risks, support staff well-being, recruitment and retention, reduce injury claims, provide a barrier, CDC, WHO, RCN, discreet, non-threatening, 7 sizes, 2 flesh colors, comes with D-ring bag, reusable and cleanable between patients, trusted Dartex fabric, failure and duty of care costs. Hannah, 24th of July 2020 at 3:13 p.m. I work as a healthcare assistant for the NHS. Whilst working one day I was putting mittens on a patient who had adults in place because she kept taking off the oxygen mask. She became very agitated and aggressive with me. She pinched all of my arm, drawing blood whilst I got one mitten on. These pinches have now left me with scars on my arm. Ian Morris, 5th of August 2020 at 10:33 a.m. If the employer had failed to make you aware of the risks posed by caring for the patient who assaulted you, or not provided you with appropriate PPE, then you could pursue a claim against them for the injuries sustained. Also, if you were not trained specifically in the handling of patients with aggressive or violent tendencies, a claim can proceed. Sample, Caregiver Survey. D. I was a carer also. I had a really nasty bite and had to have a course of antibiotics and tetanus injections. Jennifer, my mum suffered from dementia and I work with sufferers of this disease. They are not as weak and frail as you think. I've been scratched till I bleed and bit so hard I hate teeth prints in my skin for days. This could really be helpful for us in the healthcare field. Stephanie, gone are the days caregivers should just accept being assaulted. It's time the laws on H&S were enforced in care homes. Tony, having worked and managed in social care for many years, arm protection is a great idea and would have prevented many injuries to care staff looking after young people with special needs. It's sad that these things are necessary. However, we all have a duty to keep ourselves and colleagues safe as much as we can. Sharona, I'd love to order a pair of arm protectors. My dad gets very aggressive at times and his caregiver has gotten scratched and almost bitten numerous times. Testimonials for prevention. Stephanie, actually, as a caregiver and daughter of a person with Alzheimer's, arm protection is a great idea. We need to protect ourselves as caregivers. Are we supposed to just be bitten or scratched? Gimme a break. Debbie, I agree as well. My mum-in-law can be physically as well as verbally abusive, and I can very sensible and practical to use arm guards. Think yourself lucky that your mother isn't violent. Roseanne, I've also worked with dementia sufferers and they are not all frail and weak and many go through an aggressive phase. It's not being weak or offensive to protect carers from injury. Thanks for raising this, Karen. Linda, this could have saved me being scarred for life by 7-year-old. Rob, so, how about carers who are hemophilia? Arm protection could be of benefit, not to be dismissed. Reducing arm injuries, Challenge 2021. All the HSE laws and all NHS guidance shows if you are at risk of injury at work, appropriate PPE must be provided. So why are our health and social caregivers still experiencing preventable arm injuries on a daily basis? The law must be enforced, and arm injuries in areas where the risk is foreseeable must stop. Appropriate arm protection for those at risk must be enforced, particularly with carers, as they do not have the same rights as NHS and cannot withdraw care. Carers are being put at risk because the laws are not being enforced. Carers being scratched and bitten on their arms, to quote Unison, it's not part of the job. Care organizations must uphold their duty of care. Nails and teeth must be included on risk assessments. Would we allow a construction worker to go on a site without a hard hat? Some NHS trusts, like Sheffield Health and Social Care, already made the decision to reduce arm injuries and have implemented appropriate PPE, but it should be standard practice, not just potluck. Juliet Osborne, behavioral safety trainer, it's quite a shock to see the difference in levels of enforcement between construction and rail, predominantly male, versus caregivers, predominantly female. If injuries happened like this, A, the site would be closed down. B, ownership is at the highest level, hence the stringent compliance in these male-dominated environments. End-user feedback. Sybil Cameron, volunteer at Helping Hands, an early-onset dementia sufferer, said, "I have seen the most gentile, frailest ladies, not intentionally, scratch and attack caregivers. As my dementia gets worse, I would hate to think that I scratched a carer. I would be happy for my carer to wear them. Patients would rather not have skin-to-skin contact when experiencing intimate personal care. 94% preferred use of gloves for washing private parts. IPJ public perceptions of the use of gloves by healthcare workers in comparison with perceptions of student nurses." gipskins arm protectors, supporting the needs of the NHS and the goals of our NHS people. Promise, we are safe and healthy. All health boards have a duty of care to protect their staff from attack. Bob McGlashan, senior officer at the Royal College of Nursing, RCN, said they should not have to put up with verbal or physical assaults from those they are caring for or their families. One assault on a nurse or any other healthcare worker is one assault too many at any time, never mind during the pandemic. They are expected to have policies in place to deal with these distressing situations and must always listen to their staff. Size Guide: How to order the correct size gipskins. Reduce your risks today. Contact 080019343373 or visit www.gipskins.co.uk. Lisa Wynne, Contracts Manager, Northampton Mental Health NHSFT. Our nurses were being scratched by an infected mental health patient. gipskins prevented them from withdrawing care. Milestone Academy. In our environment, our staff are subjected to pinching, use of fingernails and biting from time to time. We have tried out a number of different arm protection options, none of which were ideal. Having been introduced to gipskins, we have found this product to be highly effective and not aggressive looking, therefore have rolled it out across the academy as our arm protection of choice. Stuart Norris, Business Manager, Milestone Academy. Jackie Hunt, Lead Infection Control, Southern Health NHSFT. Bites and scratches to the arms are common in mental health settings. Anne-Marie's Rook. Absolutely fantastic product, and exceptional customer service. Ordered these for my son's PAs to use, as he can be somewhat grabby. He can't grab hold of their arms, and it deters him from doing so. Hope you are a success, as it's a tremendous idea. Thank you. Annette Moyer, having lymphoma, wearing my gipskins makes me feel secure and confident. gipskins, the hard hat of the care industry, by Joseph Locker, journalist, Nottingham Evening Post.